The passage and implementation of the Affordable Care Act sparked controversial debates about the affordability and access to health care in our country. But in Goshen, Indiana, the Maple City Health Clinic came up with a new way for its low-income patients to pay for care. Claire McInerney tells us more about the health clinic's unique approach to serving its patients.
Paloma Quintana was 14 when she found out she was pregnant with her first child. The stress was overwhelming. Quintana became depressed and began drinking. She needed help for herself and her unborn baby, but doors kept getting slammed in her face.
Because I was really young and nobody wanted me to, in their clinic because they thought they were gonna get in trouble for accepting a 14-year-old and pregnant, so we talked and Dr. James, I think he was the one who said, well, yeah, let's do it. And so she can have, a good pregnancy and all that, a healthy pregnancy.
Improving health almost invariably means significant change in how we function, one way or another.
Gingrich calls it integrated healthcare, not just treating the symptoms, but looking at a patient's entire life. Like Quintana, a lot of pregnant women who come to Gingrich's Maple City Clinic aren't prepared to give birth and be mothers. One of the requirements of Maple City's prenatal care is attending group sessions with other pregnant women to talk about expectations and to prepare for motherhood.
We talk about baby names and labor and about what we wanted to have in our hospital room, in the hospital. We wanted to have a bath, in the room, yeah. And how your body works when you're pregnant.
And to help their patients with the stress of financing their health care, Maple City uses a sliding fee discount system based on income and size of family, whether they have insurance or not. When the recession hit, though, Gingrich says even patients with discounted copays and medications stopped coming altogether.
We were sitting around as a staff talking about this, and suddenly one of our staff members asked the simple question, if these people don't have money, what do they have? And the obvious answer was time. They're unemployed.
But how do you use free time to pay for health care? By volunteering. Gingrich and his staff partnered with local charities like The Window, a center that provides basic need services, to accept Maple City patients as volunteers.
What happens is they will come from Maple City Health Center, and they have a certain amount of hours that they have to work off. And for every hour, they get $10 off their bill.
Not only does this program help patients pay for care, but it's having an impact on the entire Goshen community.
Our community is in great need. Unemployment's been high in our area. There's a lot of people that are out of work, and they find that they're struggling to pay something like a medical bill that others are just take for granted to be able to pay. And so to offer that and offer it to the community to come out and help those people by doing some volunteer work, I guess that's the knitted impact that it seems like it has for the community.
This system is another way the clinic engages patients like Quintana into owning their health care. She says without the support from Maple City during her pregnancies, her 3-year-old daughter and 1.5-year-old son would not be healthy today. She received counseling to cope with the stress of motherhood and now works with a nutritionist to manage her weight. And because she's paying on a sliding scale, she doesn't feel like she's receiving a free handout.
They help me, and they give me a lot of chances and opportunities, to pay my bills on time and not to worry about that I'm gonna, not gonna come anymore here to bring my kids.
Quintana is working on her GED and says she wants to eventually become a nurse. Reporter Claire McInerney joins us now with more. If the clinic allows their patients to pay bills by doing community service, then how does the clinic actually make money?
Sure, and just to be clear, the charities themselves are not
paying a wage to the patients or writing a check themselves to Maple City. The 1 hour of community service for $10 on your bill is more of a way to engage the patients in their care and make sure that they are working hard for that care that they get, even if they can't provide money. So just like, they're not a free clinic, they are a family practice. So not everyone there is low income. There are people there with insurance that can pay their copays and medications in full, and those people offset the cost of the people who qualify for the sliding scale. They also have recently started getting more grants and federal funding because they have such a unique model. People are kind of rewarding it. So that's how they're doing it. Dr. Gingrich even told me once they started the More Than Money program, they actually saw their profits rise because if someone was unemployed and qualified for the sliding scale, when they were employed again and had the money, they came back and paid more because they were so grateful they were able to get the care when they needed it.
Now, is this payment model that Maple City uses scalable, meaning that can this be developed in cities like Indianapolis?
It's a tricky question, and I asked everyone up in Goshen that I talked to the same question, and the simple answer is yes, but, is what everyone said. Dr. Gingrich said, yes, but you can't take their model and apply it anywhere. You have to know the needs of your community and the struggles of your community. He has lived in Goshen for years, worked there, served patients for a long time, so he knew what was needed, what struggles his patients went through. You would have to adapt the model to whatever city and maybe not do volunteer to pay it off, but something different.
Now, you briefly mentioned the pregnancy group. Are there other activities like that they provide?
Yeah, they have healthy living groups. They take people to the farmers market. They do cooking classes. They do something called warm handoffs, where if a patient comes in and they're pre-diabetic, instead of just saying, go home, lose weight, exercise, they say, you need to exercise and lose weight, but here's a nutritionist to give you meal plans. Here's a counselor if you're a little depressed about being pre-diabetic, and all of that is part of their care and free.
We've been hearing a lot about the Affordable Care Act implementation. Does that have any effect now on these programs that they're offering?
It shouldn't, because the Affordable Care Act is providing insurance for people without insurance. So if one of the people who didn't have insurance before suddenly is covered, that just means they might not have to use the sliding scale anymore, or they might not have to participate in More Than Money. So it's only a positive, but even if they are covered, I think it's important to say they don't discount insurance companies, they discount what the patient is responsible for, so a copay or something.
All right, well, thank you very much,
Yeah,
Claire,
thank you,
for
Joe.
that information. Very helpful.
Yeah, thank you.